teenager students do not take action upon their mental health because of ignorance, lack of importance on the problem, or just surrender for a solution.
While making a research through different authors in the way of thinking about the mental health awareness of teenagers and children, we found 3 authors who published their essays, research papers, and books about the importance of the mental health awareness. How are those problems created in the person, how they affect the life of the person in short and long terms. Starting mostly in the childhood, the development of these complications. The teenage students do not take action upon their mental health because of ignorance, lack of importance on the problem, or just surrender for a solution.
What is mental health? The range of conditions such as attention deficit hyperactivity disorder, autism spectrum, depressive disorder, anxiety disorder, or impulse control, among others. They are classified between externalizing conditions and internalizing conditions. The externalizing conditions can be such as problem behaviors and conduct disorders, while internalizing conditions are, as an example, anxiety and depression. They can be seen in childhood and adolescence.
To understand how mental health problems can be developed, I will show you some diagrams presented in Dr. Zúñiga's investigation, which will hopefully help you understand the importance of childhood in a person's life. The first diagram I will present to you is the diamond model that Dr. Zúñiga has presented to show us how a person will develop a mental problem according to their perception of the world. According to a diamond model presented by Dr. Zúñiga, we can understand how at the top of the diamond you can see the perception or the roles that the person takes upon the life, such as being a student, a sister, a brother, an employee, a friend, a father, mother, etc. It all depends on the person. For you to better understand the diamond model presented by Dr. Zúñiga, I'm going to show you an example that can be shown in the diagram. So one of the examples that Dr. Zúñiga makes in this investigation, that shows in this investigation, is the death of a parent. Okay, so when we contrast the death of a parent during childhood and one during adulthood, we can see that during childhood, the kid or the child can take that action or that situation as its fault. Like they think that they are the ones with the guilt of that happening and tend to develop guilt, anxiety, depression, or many other things that can affect its life. While comparing it to when it happens in adulthood, they are more mature, they have more conscious, and they know what are the reasons that maybe when they were kids they couldn't understand. So that is the importance of why you have to take care during childhood about the situations around the kid, because they may take it up on their fault or something like that, which can affect them. So also with the diamond model, we can see how Dr. Zúñiga takes the mind as a computer, in which it says how the person is developing or creating itself. Like during childhood, it is only 65% of the person where they gain their identity, their language, and that kind of stuff. While from 5 to 21 years old, they become the 95% of themselves, in which they get education and they start, forming their person like greater. But then when you get to the 25 to the 30, you can get a 5% more about the the building of the person, in which they gain more the education and they start getting into the things that they like, because they already know who they are and what they want in their life. So we just can see how the person, as it is growing out, it's gaining more knowledge. It could be like intra knowledge or extra knowledge, which will be later used for dealing with situations like the ones you were trying to avoid during childhood.
By the time people are diagnosed of a mental illness and they don't know how to react or look for a solution, mostly in teenagers, they don't know give importance because they don't know have time, or they think that their classmates will not accept them. So it is found that there appears tense between the young people, and also this problem brings impact in the school. When the people suffer from depression, their solution is the alcohol, drugs, and self-injury. In an extreme case, the suicide, mostly in students of the first year of a school while the students of the last.
Usually, what the program and treatment focus on is on the symptoms, in how to control them and how to detect them throughout a program that is only or mainly applied on an individual children that has mental health conditions. All this to only reduce the symptoms for a short period of time, which invalidates the development of the children on an educational or employment area. Consequently, the treatment children are demanded to have a poor lifestyle with a lot of setbacks for them. The many programs to treat the mental health have the same recommendation or solutions to the treatment of the mental health problems of children. The students in the USA present that most of the teenagers that present emotional instability are the highest rate of dropout and are unlikely to attend college.
So now I'm going to take one of the diagrams presented in the developmental complications now to present my literature review, where we are going to talk about preventing guilt during childhood, which is presented also in the other section in the diagram about how a situation can be taken differently depending on the age of the person. So now I'm going to use again Zuniga's investigation in order to explain how we can prevent this guilt during childhood. Well, first of all, we have that it is important, really important, to give information to the children. It is important to give this kind of information or data because it is necessary for them to understand the situations they are living during childhood exactly more. If it is a divorce or even if it's that one of the parents, it is important for them to know that they are not the ones guilty for it. They need to know that it is something that commonly happens, and we need to give them a context so that they don't misunderstand the situation and they do not develop any type of complication. The second is the most important and obvious factor, which is obviously giving health education to children, but not only to children, but also adolescents and also adults, because we need to make this topic not a taboo. We need them to know that it is something common and should not be avoided. We need to get more information about this and try the best to prevent it and obviously solve it in any kind of way and give them opportunities to change the matter.
One of the recommendations that are used for preventing the issues are the conferences. But according to Tinto, Pasquarelli and Terenzini, say that the students experience programs, but they should focus on a non-academic needs as well as academic. It is because the students tend to have problems outside of school. Cuellar says that one approach to mental health is prevention rather than treatment. This encompasses both primary prevention, or preventing mental health problems before they occur, and secondary prevention, which involves minimizing or correcting the course of the problem once it began to manifest. What Cuellar explains is that prevention is better than only treatment because of the importance to have a backup report of well-being of the person before some kind of condition starts to form throughout the years. And by preventing from the beginning the type of problem, this could be easier to be analyzed, controlled, and in major cases, treat.
What we tried to accomplish with this research paper was to understand the situation and why the adolescents do not take care upon their own mental health. It is both because of the lack of importance that it is given to this topic. There's still a taboo around this problem and around the situation, and that makes adolescents be away from the situation. But also it is because of the lack of programs and help that is reachable and approachable for the adolescents, and that's why we're trying to implement this kind of research paper where you can start reading and start comprehending the situation, so in the hopes for you to understand what is going on and why you should take care of your own mental health.